A very good evening. I'm Aditi Lamba with the Thursday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New Jersey. Welcome to the show. Let's begin the episode taking a look at the coronavirus pandemic updates and measures. The world is at more than 268 million COVID-19 cases and more than 5 million deaths. Even as the emergence of the Omicron variant has added urgency to booster campaigns, the World Health Organization said that priority still should be to get more first shots to hundreds of millions of unvaccinated people, especially in vulnerable, low-income countries where there is a lack of vaccine access. The WHO has also said that vaccine equity is being threatened right now. Here in the United States, we are at more than 49 million cases of COVID-19 and more than 792,000 deaths. The U.S. healthcare system has been struggling with Delta-fueled hospitalizations as the threat of Omicron also looms over. Again, most number of cases and deaths are being seen amongst the unvaccinated. Experts all over are pleading Americans to get their first dose or get the booster dose if they are eligible. And on that, today, the FDA authorized Pfizer-BioNTech's boosters for 16 and 17-year-olds. Currently, nearly 200 million Americans are fully vaccinated, so remember, you can be a part of this. Visit vaccine.gov to find all information on vaccines and boosters. With that, tonight we continue to discuss more on COVID-19 updates along with a look into efforts to empower health and well-being among South Asians. Let's now take a look at the headlines coming in. FDA authorizes Pfizer-BioNTech boosters for 16 and 17-year-olds. Dr. Rachna Kulkarni, New Jersey. ITV Gold exclusive featuring KV Kumar, Indian American International Chamber of Commerce. Groundbreaking ceremony for Arbor Village Assisted Living, Smithville, New Jersey. On coronavirus updates and measures, today the U.S. Food and Drug Administration authorized booster shots of the COVID-19 vaccine from Pfizer for young adults 16 and 17. Public health officials have urged Americans to get additional shots on concerns about the new Omicron variant of the coronavirus. This emergency use authorization will allow 16 and 17-year-olds to receive their third shot at least 6 months after their second vaccine dose. Currently, all U.S. adults are eligible for booster shots of the 3 COVID-19 vaccines from Pfizer, Moderna, and Johnson & Johnson. This authorization comes a day after Pfizer released data suggesting that booster shots could be a key to protection against the concerning Omicron variant of the coronavirus. The Centers for Disease Control and Prevention have identified fewer than 100 cases of Omicron in our country so far, but they expect this number to increase in the next coming weeks and months. Meanwhile, Delta variant of the coronavirus still continues to dominate and has driven up infections. We're averaging about 120,000 new cases per day, and colder regions such as here in the Northeast, we are starting to see a concerning uptick of cases. On this and much more, earlier today we spoke with Dr. Rachna Kulkarni. Here is Dr. Kulkarni. About the biggest news coming in today, Doctor, the FDA has given emergency use authorization for the booster dose for 16 and 7-year-olds. Huge news. People are calling it a game changer. I'd like to know, how are you observing this news and how important do you think this step was for the FDA to take?
I think with the holiday season coming, we are all going to get together. This is the time for family gatherings, and having this authorization, this recommendation will be a huge safety net for all of us to get together. This has been a rough year and a half for us, and everyone wants to get together with their families, with their grandparents. Multiple generations will be coming together. So having these young adults getting boosted would be the great thing. And Aditi, at this point, getting a booster is the new definition of being fully vaccinated. So I would like all our viewers to know this, that if at this point, if you can get a booster, because that's when you're fully vaccinated, because the immunity from previous vaccination has started waning off.
Right. Let's talk about what is happening in the country, because it is kind of concerning, and we are in the Northeast, doctors, so we keep on hearing that we all have to be extra careful now with the winter season coming. We're at 49 million cases, actually more than that in the country right now. 792,000 deaths total in the nation. Currently, we are seeing 120,000 cases per day, all related to Delta mainly. Please explain to us, why is this happening right now? How concerned are you, and what do we need to do with this holiday season coming especially?
Great questions, because this should be a concern for all of us. As you said, the whole country, the entire nation is seeing a huge surge in the infections. New Jersey has reported a significant increase in all the cases, and most of the cases are because of the Delta variant. We should also see not just New Jersey, but let's focus on the entire Northeast, because there are some very worrisome trends emerging. Let's look at New Hampshire and Vermont, and I'll tell you why I'm saying that. New Hampshire and Vermont have approximately 70% of their population vaccinated, just very similar to New Jersey. And from an infectious disease perspective, when we are tracking their trends, New Jersey usually tends to be about 2 weeks behind these states. And at this point, we are seeing a huge surge in COVID-19 cases, mostly because of the Delta variant in Vermont and New Hampshire. These states were at pretty low numbers in the first surge. Now they're seeing a huge surge, and their rates of hospitalizations are more than ever. So just to follow the trend that we have historically followed for a year and a half, I do think that we are going to see a big surge in the hospitalizations. And unfortunately, our death rates will climb. Good news is, from our perspective, we now know how to take care of COVID-19 cases much better than we had before.
In Galloway Township of New Jersey, historic Smithville is set to become more hospitable to its residents. Yesterday, a groundbreaking ceremony was held for Arbor Village Assisted Living Facility to be built next to a quaint shopping center. JW Living and Assisted Living Division of Norwood Bergen County Windsor Healthcare will run this development, making it the first assisted living facility to be built in the township in the last 2 decades. Arbor Village will feature 130 rooms spread around over more than 100,000 square foot facility. The building will include a library, movie theater, and activity room, along with fitness area, doctor suite, and a central courtyard. This move will help many residents of Smithville to stay in the township if they require assisted living, and will cater to the senior population who could be dealing with issues such as dementia, Alzheimer's, and more. We have tonight highlights from the groundbreaking ceremony, which also saw in support and attendance ITV Ghost Chairman Padma Shri Dr. Sudhir Parikh. Here is the story.
very long road, about 2.5 years to get here. We're super excited to be here. First time I drove into Smithville, and I told this when I met with Tony years ago, this immediately I envisioned something over here, some sort of healthcare campus that can serve the community and that can serve this community and the greater community around. We're very, very excited about it. We have a great construction team, Sweetwater Construction. We have a great architectural firm behind us, and we're just super excited to be here. And there was a lot of hard work to get here. And for those that were involved, and for those that are getting involved today, thank you for coming. I thank you for the hard work putting in to get here, and looking forward to a very successful project. Morning, everyone. I'm Michael Jacobs from JW Living. Very excited to be here today on a groundbreaking ceremony of a new state-of-the-art 130-bed assisted living with a memory care component in Smithville, New Jersey. 2.5 years of planning. We finally came to this day where you can see behind me, trucks are moving earth. We're getting ready to break ground. We're hoping to open up in 14 or 15 months. We should be completed. I want to thank Dr. Parikh for his involvement in this, and to thank everyone else for this long road here, but we're very excited to be here today. Thank you.
Good afternoon, everybody. This is Tony Coppola from Smithville Hospitality here in Smithville, New Jersey. Today's a great day. We welcomed Windsor Healthcare and JW Living to the Smithville community here with our groundbreaking. We're very excited about this project. It's going to be great for the community. We talked to JW Living probably about 2 years ago and started to have dialogue about this project. And over the years, we expressed to them how important it was to fit in well to the Smithville community. We really think they've done a good job doing that. Their plans are excellent. They've done a great job integrating the design concepts into the existing Smithville community. We're very excited to have them as partners here. My family has been involved in Smithville for the past 30 years, and we were looking for a partner that shared our enthusiasm for this area and their passion for delivering good customer service. The first few healthcare providers that we talked to, we didn't get a warm and fuzzy feeling about. But as soon as we met Michael Jacobs and his team from Windsor Healthcare, we knew these were the guys. So we undertook this project with them, and we couldn't be happier with the outcome and the progress so far. Looking forward to the building process and watching this thing rise out of the ground and being an asset for our community.
We are very excited for our official groundbreaking of JW Living, our first assisted living in New Jersey, new build, and our first assisted living in South Jersey in Galloway Township. We are really looking forward to being partners with Smithville and being members of the community. We've met so many wonderful people today, and we're just excited for this new venture and many more to come. Thank you.
Hi, good morning, everyone. What an exciting day in Smithville, New Jersey. JW Livings is building an assisted living memory care unit here. It's one of a kind. We'll be the only one who'll be providing an extended level of services here. And as you can see, the huge group of local leadership as well as the local community had gathered today to give us the blessings of the event and kick off. We had a little ceremony this morning about the groundbreaking, and we are very excited to do the best what we are at, which is serving the community. And I also want to thank Mayor of a town to give his presence for the event today. And thank you, Dr. Parikh and the ITV Gold to provide us a media coverage. Thank you.
Hi, my name is Chris Metternich. I'm the Chief Operating Officer for Windsor Healthcare Management. And we just had a wonderful discussion with the community of Smithville, and really the discussions about what is the project going to be and what is the construction timelines and some of the constraints of the construction that's going on with the Smithville project. We're exceptionally excited as an organization to be in Smithville, and we've coordinated with the community to make sure that our physical plant matches the community in which we're in, and also that we're going to communicate extremely well with the community surrounding us. So I've offered to the community and the community members that were here that we would have continuous meetings. I've given them my contact information, and we're looking forward to having continuous meetings throughout the course of the construction period, and ultimately for the pre-sale and the ultimate operation of the facility. So we're very excited to be here, and I thank everyone for attending today. Thank you.
We have now an exclusive segment featuring Mr. KV Kumar, the founding chairman and CEO of the Indian American International Chamber of Commerce in Washington, D.C. A proud Indian American, Mr. KV Kumar has dedicated his life to volunteer work efforts across the nation, having done more than 147,000 hours of volunteering over the last 16 years. Mr. Kumar is also the chairman of the KMF Investment Group and has been a leader in the conversation of economic and trade relationships between India and the United States. The Chamber of Commerce that he heads promotes and fosters economic development of the United States and Republic of India together with the rest of the world for the benefit of all. The Chamber represents hundreds of Indian entrepreneurs and businesses in the country. Calling itself a sustainable platform and leadership forum for entrepreneurs, professionals, businesses, and governments, the Indian American International Chamber of Commerce also provides vital resources and support to educate, train, and mentor. We spoke with Mr. KV Kumar on the Chamber and much more. Here is a segment of the exclusive conversation. Mr. KV Kumar, welcome to ITV Gold. Thank you so much for giving us your time today.
Thank you very much, Aditi. It is an honor to be here with you.
Well, it's an honor to have you because we have a lot of questions for you. There's little time, so let's go right into it, Mr. Kumar.
Sure.
My first question to you has to be about the Indian American International Chamber of Commerce. You're the founding chairman and the CEO for the foundation, the organization. So the first question to you has to be about, tell us a little bit about this Chamber of Commerce and why did you decide to create it? Take us a little bit back into history about it.
I was the Washington, D.C. Tri-State chapter president of the Indo-American Chamber of Commerce at that time. We had a visitor from India, Mr. Harishankar Singhania, one of the leading businessmen from India. And he said he thought, U.S.-India relations should be on a national basis. And he advised me, why don't you create a national organization? Because there were some local chambers, and he wanted to have a centrally located chamber in Washington, D.C. to coordinate. I thought that was a great idea.
Oh, yes, of course. And then tell us about how big is this Chamber of Commerce? How far are you spread? Who do you really represent in that sense?
There are 600,000 Indian American owned or operated businesses in the United States.
Wow.
And we hope to capture a majority of the group of those people. And our chamber went through certain changes over the last 30 years, at different time intervals. And, people didn't take it the way it should have gone. And in 2017, they summoned me back. The board said, KV, it's your time to really bring it back. Since then, I took over towards the end of 2017, and we started the first chapter of the chamber in Atlanta, Georgia. And very nice of Dr. Kulkarni to host it. And we had the Minister for External Affairs for State, Dr. V.K. Singh, who came and inaugurated that one. We had a lot of other important people from the United States and the state of Georgia. And from there, we started a chapter in California, one in New York, and one in Arizona. Now we are in the process of starting almost 14 chapters in the nation. Without the COVID, we would have probably have at least 5,000 members by now, but that was kind of set us back. But we do have offices in New Delhi and Kolkata, Mumbai, and Bangalore. And we are planning to establish offices in Singapore, Dubai, 7 African countries and 5 Latin American countries, and 17 Asian countries, and 6 European nations.
You obviously saw and clearly saw a lack of representation of the community in the world of business and entrepreneurship.
Yes.
And you've really been focused on that, and you're pushing more and more people in that path. When you were founding this Chamber of Commerce, what was something that you definitely saw was missing, and what did you want to target, and are you happy with where you have reached with that?
I'm not really happy with what we have reached, but we are on the way to great success. And I think your question was, why did we start and what was missing?
Yes.
The answer is really, we were not very well connected between US and India. We were not very well connected. There were bits and pieces of organizations doing things, and we weren't really connected. And we mainly concentrate with the growth of small businesses and entrepreneurs. And connectivity is the main thing that we are working on. Connecting people with businesses, corporations, entrepreneurs, the governments together, bringing them together, both within the US, between US and India, between US, India, and the rest of the world.
Yeah.
And thanks to Dr. Sudhir Parikh, who has been a great asset to us, and he also agreed to take over a new role as the chairman of IAICC PAC, which is going to play a very major role in our chamber to support good candidates at local, state, and national levels.
What is your biggest goal with this chamber?
There is no one biggest goal,
Right.
but there are few goals,
Yeah.
few biggest goals. The first one being better US-India relations. With that better relationship, we can accomplish better business dealings, trade and other arrangements between the two countries. But we are not satisfied with just the two countries. Between US and India and the rest of the world, that's what we are working on.
Well, with this, we wrap up our show for the night. Please send us your suggestions and get your voices and organizations on our show. You can email us on events@itvgold.com or follow us on our Facebook handle @ITVGold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Edison, New Jersey. This is Vision of Asia, and I am Diti Lamba. Take care and be well.